everyone, it's Dr. Russell. So in honor of Heart Health Month, we're obviously going with the theme this month, we're going to talk about an herb that you probably have in your pantry but might not have ever thought that it could help with benefiting the heart. And I'm wearing red in honor of Heart Health Month. So that herb that we're going to talk about is rosemary. So rosemary, the Latin name is Rosmarinus officinalis. Again, probably most of you have seen it cooked with it. I particularly like it on potatoes. It's really tasty. But this herb is actually really beneficial for the heart and a few other things. So to start, we use the leaves and the flowers. Again, you've probably seen it dried. It is quite a bitter herb, so pretty strong flavor. So if you use it, whether in cooking or taking as a tincture or a tea, just kind of be warned that it has a strong flavor to it. It's also thought to be more of a heating and drying herb. So if someone already is more on the dry side of things or already really hot, this might not be the herb for them. So just something to think about. But as far as when it comes to heart health and heart support, it really helps stimulate the circulatory system to help get blood to flow into more places. So it really helps get more blood into the tissues. It especially has an affinity for the brain and the head. And because of that, it has benefits for depression, whether that's because we're getting more oxygenation and blood flow to that area, helping the brain function better. Who knows, but we do know it's a really great antidepressant, but also helps, again, flow more blood to the rest of the tissues in the body. So great circulatory stimulant. Because of that, we can also use it for congestive heart failure, also for hypotension. So if your blood pressure is low, maybe you find that a lot of times you go from sitting to standing and then you kind of get dizzy and your blood pressure drops. So this might be a good herb for you to incorporate to kind of help with that. So as far as some other benefits it has, because of the bitter taste to it, it's what we call a carminative. So it really helps with digestion, especially if you have some gas and bloating. Rosemary is something you might want to start using more of. It also is a really strong and great antioxidant. So antioxidants are going to help combat inflammation and oxidative damage that occurs in the body. And while it won't directly affect cholesterol, cholesterol is a response to inflammation and damage. So using rosemary might help benefit indirectly that way as well for heart health. Again, it is really good for depression. So I use this personally more for in my tinctures for people with pretty severe or strong depression as part of a combo for things, but it's really beneficial. So the only people that should avoid this herb are for pregnancy. It might help stimulate things that we don't want to stimulate, so I would just avoid rosemary for that. As far as dosing, obviously you can cook with it, but for stronger dosing, more of a medicinal dose, I would definitely do a tincture. So, a half teaspoon to a teaspoon up to 3 times a day. You could also do it as a tea. That might be pretty strong. Maybe mix it with some other herbs that are pretty tasty. And you could also do, even as they have rosemary wines, that might be another option instead of doing a tincture. So many different options for that. So again, rosemary, surprisingly good herb for the circulatory system, just gets more blood to the tissue. And if you want to learn about more herbs for the heart, we did have a video from last year about Leonoris cardiaca, which is motherwort. So I'll post a link to that video below so you can watch that video as well. So hopefully that was helpful. Please let me know if you have any questions.